today's results, Professor, what's your latest guidance on the wearing of masks amongst the South Australian community?
I am going to start more strongly recommending that people wear masks in our state. We gave advice yesterday that if you can't maintain your 1.5 metres distancing, you should be wearing a mask, and that might be on public transport, but it might also be in crowded rooms.
Professor, the update on the patients, are they all in stable conditions?
Yes, fortunately, everybody's remained in a stable condition.
In terms of to clear the backlog, we're talking hours and hours and hours of wait time. Are you receptive, or are you investigating around-the-clock testing, 24-hour testing? And secondly, are you concerned that you are going to lose the public's trust in getting tested because people are not wanting to line up for 8, 9, 10, 12 hours to get a 15-minute test when it's so important and critical?
Yeah, this is the forefront of my mind today when I heard what the waiting time was, and we've got a team working on solving that. We know we've got the testing capability, i.e. the machinery to get it through. It's actually getting the test done on people. So we're looking at bringing on substantial additional staffing. I would love to have 24-hour testing, but we've also got to think about the safety of people, because after hours, obviously, there's more issues with security.
Earlier today, you mentioned yesterday who you were expecting to be positive cases. What's their status today?
So they have come back with repeat negative PCRs, but we are not winding back the public health response, which was the quarantining of close contacts, because again, I am being extra cautious.
So all 3 are negative?
Yes.
The Federal Health Minister earlier today was encouraging people to get tests if they are asymptomatic. It seemed to be in contradiction to what you said yesterday. What is the advice for people who aren't seeing symptoms that aren't a part of this close contact?
I am wanting people with symptoms primarily to come forward and get tested. What I don't want is our public health system, our SA pathology and our private labs to get clogged with people who are the worried well. So for us in our state, our priority is anybody that has been asked by public health to get a test done, regardless of whether they're symptomatic or asymptomatic. The next group is anybody that has been to any of the locations listed and developed symptoms. You must get tested straight away. And then the last group is the whole of South Australia. If you have respiratory symptoms that fit with COVID, then please get tested.
Can I just clarify today's numbers? So there are 5 cases, one of which is not related to the cluster?
There's 5 cases, one of which I have only been told about in the last hour and is currently being interviewed, and I don't have any further information about that.
These schools, there's a number of schools that have been closed. How many close or casual contacts are there within these schools? Are the students that have been forced into quarantine?
I don't have the numbers of those. Again, we're trying to add up numbers, but that hasn't been my priority to get the number of students, but it's a significant number.
What's the risk within those schools that there has been an infection in terms of how long could these kids have been in these schools while positive?
It's probably in the scheme of things, in terms of all of my concerns, it's probably in the middle. My highest concern, obviously, is for the aged care facility and also the correctional facility.